Thank you very much. Appreciate it. A lot of tremendous things are happening. The number of new positive cases continue to decline nationwide. Recent hotspots appear to be stabilizing. The hotspots are, in some cases, very interesting what's going on, and they're going down. They're going in the right direction. Cases in the Boston area are now declining. The Chicago curve appears to have flattened, which is terrific, and Detroit has passed its peak. These trends demonstrate that our aggressive strategy to battle the virus is working and that more states will soon be in a position to gradually and safely reopen. That's very exciting. It was very exciting even today watching and seeing what's happening, and people are getting ready and they're all excited. I do want to mention a man who's done a very good job for us, Dr. Robert Redfield, was totally misquoted in the media on a statement about the fall season and the virus. Totally misquoted. I spoke to him. He said it was ridiculous. He was talking about the flu and corona coming together at the same time. And corona could be just some little flare-ups that we'll take care of. We're going to knock it out. We'll knock it out fast. But that's what he was referring to, coming together at the same time. And I think rather than waiting, I'd ask Dr. Redfield to come up and say a couple of words just to straighten that out, because he didn't say it was a big explosion. The headline in the Washington Post was totally inaccurate. The statement wasn't bad in the Post, but the headline was ridiculous, which is, as I say, that's fake news, and CNN is fake news like crazy, and they had just totally the wrong story, which they knew. They were asked to change it, and they wouldn't do that. It was false. So I'll ask Dr. Redfield, who is a real It's been encouraging to watch states begin to open up, and it really has been. It's a beautiful thing to see. As restrictions are lifted, we must maintain vigilance and continue practicing social distancing. I encourage governors to follow a careful, phased approach, and I want to remind all Americans to adhere to our guidelines. Very important. The governors are going to adhere, hopefully, or they're going to do what they think is best. I want them to do what they think is best, but ideally they'll adhere. Wash your hands, avoid close physical contact as much as possible, and wear a face covering when distancing is impractical. There are cases. We've flattened the curve and really made tremendous progress, but we must guard against a dangerous rebound. We don't want a rebound. That's so important. This is what we're just talking about. We don't want a rebound. The doctor doesn't want a rebound. These people definitely don't want a rebound. I don't think you want one, do you? Huh? You, especially. We don't want rebounds after all this death that we've suffered. Not work. I don't view work. I view it death that was unnecessary. Should have never happened. Should have never left that little area where it started. You know it, and I know it, and they know it. In our all-out war against the virus, we continue to make great strides on testing, famous testing, doing more than anybody else anywhere in the world. Nothing funny about that, John. Most of the governors have never faced a situation like this before, but we're helping them find unused testing capacity within their states. Tremendous testing capacity that the governors, in many cases, didn't know they had. And additional capabilities are coming online every day. We're coming up with new equipment, like the Abbott Laboratories equipment, on-site, 5 minutes, great success. Everybody wants it. But you can only make so many of those machines, so we have many other forms of testing. We have many other machines that do it very quickly and by the millions. Our task force issued its reopening guidelines earlier than April 30th to give governors the time that they needed to develop testing capability and capacity and customize plans for their states, which many of them did. We've had some governors do a fantastic job on testing and on a lot of other things. I spoke, as you know, Governor Cuomo was here. We had a great conversation on testing yesterday, and they're doing a really good job in New York. We're working very closely with each of the states to help them succeed. I spoke earlier today with Governor Newsom, California, and that was all about testing, that conversation. He's been scaling up really well, really good job. And I agreed to help him get some of the critical supplies that California needs to make use of the tremendous capacity that they found. This is a tremendous testing capacity. And I'm going to do it very quickly. He needs certain things. We're going to get that to him very quickly. Now, could he get it himself? Yes, but I can get it faster. He understands that, and he's done a great job. And we're going to have it to him. We're going to have a lot of it to him over the next 2 days, and we're going to beef it up the following week, get him a lot of additional. He's done a really terrific job in California. Some of the governors have done a fantastic job working with us. I told the governor of Georgia, Brian Kemp, that I disagree strongly with his decision to open certain facilities which are in violation of the Phase 1 guidelines for the incredible people of Georgia. They're incredible people. I love those people. They're great. They've been strong, resolute, but at the same time, he must do what he thinks is right. I want him to do what he thinks is right. But I disagree with him on what he's doing, but I want to let the governors do. Now, if I see something totally egregious, totally out of line, I'll do. But I think spas and beauty salons and tattoo parlors and barber shops in Phase 1, we're going to have Phase 2 very soon, is just too soon. I think it's too soon. And I love the people. I love those people that use all of those things, the spas and the beauty parlors and barber shops, tattoo parlors. I love them. But they can wait a little bit longer, just a little bit, not much, because safety has to predominate. We have to have that. So I told the governor very simply that I disagree with his decision, but he has to do what he thinks is right. I'm excited to announce that in the coming weeks, the Air Force Thunderbirds, they're incredible, and the Navy Blue Angels, equally incredible, will be performing air shows over America's major cities and some of the cities that aren't major cities. They're going to be doing a lot of work, a lot of very dangerous flying. It's dangerous. You know the odds when you start going at massive speeds and you're 18 inches away from each other. It's dangerous work. Your son is a great pilot, and I don't know if he can be. Could he be a Thunderbird? I don't know.
See.
I think he probably could, from what I hear. I don't know if I'd want him to be, because it's incredible what they're able to do, and to sacrifice our front line. What we're doing is we're paying tribute to our front line healthcare workers confronting COVID, and it's really a signal to all Americans to remain vigilant during the outbreak. This is a tribute to them, to our warriors, because they're equal warriors to those incredible pilots and all of the fighters that we have for the more traditional fights that we win, and we win. If we want to win, we always win. Sometimes we don't want to win, so we just go to a standstill. But that's always, that's not the way this country works. Operation America Strong was the idea of our great military men and women, the Thunderbirds and the Blue Angels crews, who wanted to show support to the American medical workers who, just like military members in a time of war, are fiercely running toward the fight. It's going to be great. I want to see those shows. I've seen them many times, and I can't get enough of them. And on July 4th, we'll be doing what we had at the mall, as you know. We're going to be doing it. Last year was a tremendous success, and I would imagine we'll do it. Hopefully, I can use the term forever. That was a great success, as you remember. Even though it was pouring, it was raining so hard. It was raining. That was about as hard as I've seen in a while, but it was an amazing success. Didn't bother the pilots, didn't bother the military, didn't bother the crews that we had there. So we're going to be doing that again on July 4th. Our great military is operating at 100% during this crisis, and thousands of troops are deployed alongside of civilians in the COVID hotspots. As you know, you see them all over. When I spoke with Governor Cuomo, and when I spoke to Gavin Newsom and many of the other governors, they wanted to know if we could have some military help with the medical, and we gave it to them. And in every case, they said, fantastic. I mean, just fantastic. New York City, Mayor de Blasio called me to say it was inspiring to watch. He was there when the military came in. he said it gave everybody spirit when he saw the professionalism and the spirit that they had. They walked in and they helped a lot of people, doctors, nurses, respiratory technicians and professionals. It was an incredible thing. But everybody that saw them going to work said that was something special. So we're going to have some tremendous air shows all throughout our country, and that's in honor of what we're all going through together and the people that are helping us so much. And unfortunately, the people who have passed away from something that should never have been allowed to happen. Following around-the-clock negotiations yesterday, the Senate answered my call to replenish the Paycheck Protection program so that millions of additional American workers can keep getting a paycheck. We just increased it by $310 billion. I urged the House to pass the bill without delay. In our first round of funding, we provided nearly $350 billion, and it went at record speed to American workers and small businesses. And it's really been an incredible success. I want to thank the banks. We had the big banks, the little banks, the commercial banks of all kinds. We had the community banks, who were fantastic, by the way, community banks. And as you know, this was an interesting story. In recent days, I've called for Harvard, that's Harvard University, which has a $40 billion endowment fund, to return the money that it was allocated under the CARES Act. And I'm pleased to announce that Harvard has announced today that they will not accept the funds, nor will Stanford University or many of the others that were involved, both on a university level, also on a company level. Some of the companies were bigger than people had represented or bigger than people had thought, and strong enough that they didn't need the money. So there's a certain amount of money that we are not sending. Well, as soon as I heard it, I said, stop funds. And for the most part, I guess they stopped it, Mike, right? They stopped it. But they're not accepting the money, and that's great. And so I want to thank Harvard. I want to thank Stanford, and I want to thank the other companies. In the case, it's broken differently between colleges and companies, but I want to thank the companies and the other great universities, and there's some great ones. The legislation passed by the Senate yesterday also reserves $30 billion in loans for small financial institutions that serve minority and distressed communities. Very important. We're determined to protect our African American, Hispanic American, and minority workers who have been hit so hard by this hidden enemy. My administration is pursuing a comprehensive strategy to address the full spectrum of needs in these communities, supporting both health and economic revitalization. First, my administration is committed to providing the testing that is needed to fight the virus in distressed communities. In the last month alone, we have already sent over $1.4 billion to our nation's 13,000 community health care centers. Think of that, 13,000, to increase testing and treatment in the underserved areas. We're also expanding access to telehealth. Telehealth has become a big deal. You know, I've been reading about it for years, and all of a sudden, because of this, it's become a big thing. People can't leave their houses. They didn't want to leave their houses for various reasons, including they wanted to follow the guidelines. The legislation passed by the Senate yesterday, and I want to thank everybody. A great vote. Great. It's, as you know, it was a unanimous vote. How often do you see that? But the legislation passed by the Senate yesterday includes an additional $25 billion to further expand testing and provides even more funding for community health centers and various forms of epidemics and pandemics. And we'll be working on that because, you know, as per a couple of your statements and questions before, we want to work on that for the future. We hope this doesn't happen again ever. But last time was of this magnitude, 1917. That's a long time ago. So we want to be prepared. And we are prepared. And as I told you, we're building up hospital, not only our stockpile, which is being built up greatly, but also hospital stockpiles. We're getting them what they need. We're working out cost arrangements with them. and we're getting them a lot of the ventilators, which are the hardest thing for them to get, both from a cost standpoint and a technical standpoint. At the same time, we're also supporting the establishment of new testing sites focused on these communities. 40 sites have launched so far, and there are plans to launch dozens more in the next 3 weeks. We're coming up with testing apparatus and testing plans that are incredible when you look at the numbers. And some people are very, very big on testing, but some people are much less big than I am, I will tell you, and they're professionals. But we want to have it so that nobody can talk about, gee whiz, I wish we had more testing. Nobody's done it like we've done it, and nobody will. And we're getting very much stronger. We have incredible professionals doing it. So many different tests have now evolved. People are finding it even hard to believe. My administration is working closely with governors to ensure that they have the testing infrastructure in place to reduce further spread of the virus if they're so inclined to use the testing apparatus, including strategies for older individuals, low-income Americans, minorities, and Native Americans. As part of the effort, the White House Task Force, headed up by Mike, who's done incredible. I'll say it every time. I'll say it to anybody that wants to listen. Mike Pence has done an incredible job. Really an incredible job. Thank you. Is providing technical assistance to all 50 states through one-on-one phone calls as they develop and implement their plans. In addition, my administration is committed to restoring Black and Hispanic communities to full economic health. They want to be healthy economically and physically, and that's what we're doing. To that end, today I'm directing the White House Opportunity and Revitalization Council, led by Secretary Ben Carson, to focus its effort on supporting underserved communities impacted by the coronavirus. And so Ben Carson is working on that with Mike and myself and a lot of other people. I'm going to ask Tim Scott, who was so helpful with the opportunity zones. That's an economic answer to a lot of problems, and Tim Scott was fantastic. And so I'm going to ask him to get involved with you, and sure he'll be willing to do it from South Carolina. I also asked the council to identify what additional funding will be required from Congress beyond what has already been provided. We're really building ourselves a strong base, and we're building ourselves a wall that's very different from the kind of walls that you've been hearing me talking about. But it's nevertheless, it in many ways performs the same function, and hopefully it's going to perform it equally as well. Furthermore, the council will seek input from the private sector and community leaders on how we can best support minority and distressed communities. As president, I'm absolutely determined to deliver a great future for Americans of every race, religion, color, and creed. Before our nation was attacked by this horrible enemy, our African American and Hispanic American citizens were prospering like never before. Best employment numbers ever. Not only African American, Asian American, Hispanic American, every American. We were breaking records at every level. We had almost 160 million people employed. We were never even close to that number. And we were also breaking them economically, highest stock market numbers, highest numbers of every kind. And I think we're going to be back there, and I think it's going to be much sooner rather than later, and I think we'll surpass those numbers, including our employment numbers. But I'll not rest until that prosperity has been fully restored. And again, I really believe that we're going to lift those numbers higher than ever before, and it won't be as long as people might think. A lot of very smart people are looking at that, and they're betting. You just have to look at what's going on with the stock market. In order to protect our great American workers, I've just signed an executive order temporarily suspending immigration into the United States. This will ensure that unemployed Americans of all backgrounds will be first in line for jobs as our economy reopens. Crucially, it will also preserve our healthcare resources for American patients. We have to take care of our patients. We have to take care of our great American workers. And that's what we're doing. So I've just signed it just before coming into the room. And very important, very important. And as to amending it or extending it, that we can do at the appropriate time. But it's now signed. Earlier today, the First Lady and I planted a tree on the south lawn of the White House in recognition of the 50th annual Earth Day. I was glad to announce that we will begin to reopen our national parks and public lands. We want Americans to be able to satisfy and be really safe. We want them to satisfy their family that safety is going to happen, and it will happen, and maybe even at a level like never before. We've learned so much. But we want them to enjoy these great national treasures as we continue to take reasonable precautions, and hopefully it'll be just reasonable. My administration has directed more than $7 billion in federal funding to support the development of treatments, diagnostics, and therapies, and that's something, doctors, I hope you can really work on. It's something so powerful and so important. The FDA, the NIH, and industry leaders are establishing master clinical trial protocols to test multiple promising new drugs at the same time, and we're doing a lot of testing right now. More than 1,600 locations across the country have signed up to administer convalescent plasma to patients, infusing them with antibodies of those who have recovered. And when they recover, I said it last time, practically the first thing they say is, I want to give my blood so that I can help other people. They want to give their blood. It's incredible. They're laying in bed. They're still in pretty weakened conditions, and they say, I want to give my blood, and that's happening all the time, isn't it? If you recovered from the coronavirus, I ask you to consider contacting your local blood or plasma donation center to arrange a donation that could potentially save many lives. With love for our nation and loyalty for our fellow citizens, we will safeguard our families, care for our neighbors, heal the sick, protect our workers, and build the future for a country that is the greatest country anywhere in the world, and we're only going to get greater. Thank you very much.